My name is Dr. Vincent Talosig. I'm an interventional pain specialist here at Barbour Orthopaedics. So patients with chronic pain of the spine, which include the neck, the back, the SI joints, as well as the joints, the shoulders, the hips, as well as knees. Radiofrequency ablation is actually a great option. It is a minimally invasive outpatient procedure, and the goal of this is to help those with pain that is still present after a conservative treatment. Now, how does it work? The great thing about this is minimally invasive. This is not a surgery. There's no cutting. In fact, a very small probe and really needle is inserted close to the nerve. Again, this is performed in an outpatient basis. Light sedation is used, so patients are not intubated. This is not general anesthesia. Patients are not here overnight to have this procedure performed. Patients are usually in, usually out, anywhere from 30 to 45 minutes. As soon as the patient walks in, we welcome them. We bring them back to the procedure room. There, the nurses will take their vital signs. They'll be greeted by the anesthesiologist. I come in and greet the patient. After that, sedation is placed and the patient is brought back to the procedure room, and that's where we begin. So the radiofrequency ablation is quite a simple procedure. Once the patient is nice and comfortable on the table, we use X-ray guidance to ensure the safety, where we know exactly where we're going to. We clean the area of the back. You're going to feel a little anesthetic, very similar to going to the dentist. And mind you, you also receive some medicines to relax you. At this point with X-ray guidance, we go directly to the area of the painful nerve. Once the radiofrequency electrode is in place, for your safety, we will test to see whether there's any movement down the leg. What does that indicate? It indicates warning that the electrode may be close to an area that we're not supposed to be, because obviously we want to ablate the painful nerve surrounding the facet joint. If we see that, we simply adjust the needle. We'll test it again to ensure there's no movement down the leg. Then we can begin the radiofrequency ablation. And I go directly with a fancy small probe, again, no cutting, and we go directly to what's called the medial branch nerve. Again, not the big nerve going down the leg, but the small branch that is likely causing the painful signal, for example, here at the facet joint. And once I am in the correct location, again with confirmation from X-ray, this needle tip will have radiofrequency energy, and what this will cause is an increase of the temperature to decrease the painful signals from that area that is being sent to the brain. A special electrode is placed close to the nerve, and this electrode is connected to a machine, and this machine is sending radio wave energy throughout the probe. And once the probe is close to that painful nerve, it will increase the temperature of the tissue to about the temperature of freshly brewed coffee. So we're not totally destroying the nerves per se, but that heat is high enough to start decreasing the painful signals in that area. This helps decrease the painful signals from being interpreted up higher in the brain. So what does this mean? This means pain relief in the area of the painful joints, pain relief in the area of the back, pain relief in the area of the SI joints. Again, improving your function, enhancing your quality of life. Once we know we're in that correct area, we will perform that lesion for approximately 2.5 minutes. And then after that, we will denervate the nerves that are appropriate, in this case 3 nerves. And we simply withdraw the needle. Again, that procedure takes anywhere from 30 to 45 minutes. We take the cannulas out, and from there we'll wipe your back and simply place a band-aid on that insertion point of the needle. So not large bandages, but simple band-aids in that area because it is such a small needle poke, not an incision. And then from there, you go to the recovery room. We observe you for approximately an hour, and then from there you go home. I usually tell my patients, just take it easy today. Really, because of the anesthesia, no driving, go back to your typical activities the next day. It may take 1 to 2 weeks for the nerves to decrease their painful signals in that area. Few patients may be reluctant to get this procedure done because they fear the risks. Now, mind you, in general, this is a safe procedure. So misconceptions is that this is very dangerous. The most common side effects are, number 1, post-procedure soreness. Number 2, you may have some skin sensitivity in that area. That's temporary, usually lasts a week. So do these serious adverse effects happen? They do, but it is very rare. I'm Dr. Talosig, and I am an interventional pain physician at Barbour Orthopaedics.